Rebecca Madaki, a student of Joint Professional Institute of Management of Science and Technology. My center is Barnawa, Kaduna, studying Public Health Care Management / Nursing, a 300 level student. I'm presenting a topic that says the presence of hepatitis B envelope antibody in patients who have been previously screened for the surface antigen. Hepatitis B is an inflammation of the liver caused by a double-stranded DNA virus of the family Hepatnaviridae. Hepatitis envelope is a soluble protein from the core protein. It derived hepatitis B envelope antigen is associated with the virion and also found free in the plasma, especially when there is active viral replication. Hepatitis envelope is detected with serum of person with high viral titers and indicates high effectivity. The history of hepatitis. Although hepatitis has been known for centuries, the first recorded references to hepatitis epidemic were made in 2000 BC. In 1970 DS, then discovered whole hepatitis B virus particles in blood samples examined with an electron microscope. Epidemiology of hepatitis. Hepatitis B virus is a worldwide public health problem. It is estimated that 360 million people are chronic carriers. That's 1/3 of the world's population that have been infected with hepatitis virus. Not less than 23 million Nigerians are estimated to be infected with HBV, making Nigerians one of the countries that have the highest incidence of HBV infection in the world. The pathogenesis of HBV, hepatitis envelope antigen. There are 3 important modes of transmission of HBV infection. We have the parental transmission, and we have the perinatal transmission. And we also have the sexual transmission. HBV is present in semen and vaginal secretions. HBV can be transmitted by sexual contacts. And we have the 2 types of about 5 to 10% of HBV infection result in chronic carriers. There are basically 2 types of carriers, and we have the super carriers and the simple carriers. And we have the clinical diagnosis. We can diagnose hepatitis through the hepatitis B virus infection. Has different clinical manifestation depending on the patient's age and the immune status. The stage at which the disease is recognized during the incubation is about 2 to 6 weeks. You will feel unwell with positive signs and symptoms of anorexia, vomiting, diarrhea, and patient may become jaundiced in low grade fever and loss of appetite. And we talk of the treatment. Vaccines are used in the prevention of infection, like the lamivudine, idefovir, the ritonavir, and so on and so forth. Thank you for this presentation.